Outbreak that public health experts have seen in years in spite of the warmer temperatures. Cases of pertussis and whooping cough continue to rise in parts of the tri-state.
Yeah, and it's not just the number of cases, but who is getting this infection, which has some infection specialists very concerned. Medical reporter Liz Bonus joins us now with what is being done to stop the spread. Liz.
Good afternoon, guys. Hard to believe as this weather warms up that the whooping cough cases are still climbing up, mainly in northern Kentucky. They are now asking anyone who has not had a booster shot recently to stop by a free vaccine clinic that's been set up so we can protect those most vulnerable. This infection can be deadly to an infant. Pertussis, or whooping cough, is usually characterized by a severe cough that can make that whoop-like sound, but not always.
Well, pertussis can start like the common cold, maybe a low-grade fever, runny nose, maybe some sneezing, mild cough, but then over a period of a week to 2 weeks, the cough not only persists, but gets more severe, and you get these bouts of coughing where you just can't stop, particularly at night. So, another name for it is the 100-day cough.
Dr. Lynne Saddler is the Northern Kentucky Health Department District Director of Health. She's been tracking the numbers.
We have over 230 cases.
Dr. Saddler says this outbreak likely due to a pocket in northern Kentucky and some other parts of the country. Hamilton County public health experts have not seen the same jump in pertussis. It's not just the numbers, however, that Dr. Saddler's concerned about right now. It's who's getting it. It's a group, she says, that likely needs the Tdap booster, as it's called. The initial vaccine they were given doesn't last a lifetime.
In the last 5 years, we've had a couple of outbreaks. This one has been the largest. It's also been in older school-age children, so that 7 to 17-year-old age group.
Part of the danger, she says, isn't just that you might get this bacterial infection. You might be able to fight it off, but those around you might not be so lucky. It's important for all of us to be responsible for others in our community.
It's annoying for most healthy people, but it can be very dangerous for people whose immune systems aren't up to par.
For example, newborn babies are at serious risk of complications from whooping cough. So programs such as this one at St. Elizabeth Healthcare vaccinate family members and caretakers now to protect a baby.
Unfortunately, pertussis is something that can kill a baby. Elderly folks whose immune systems aren't what they used to be, people who have compromised immune systems, they may be going through chemotherapy or have some other health conditions that are impacting their immune system. This can be very dangerous for those people.
Now, health department workers are setting up a special clinic. It's a week from today, and they are asking you if you can pre-register if you're able to stop by. That way, they will be sure to have enough vaccine for everyone. If you can't make it to that one, it's okay. Any of the major health departments right now in northern Kentucky also offering that vaccine at no charge. Here's the details. If you're age 10 or older, it's suggested you get a booster. If you've not had one, it's the Tdap vaccine. You can ask your doctor. The clinic next week is at St. Paul's School in Florence on Dixie Highway, runs from 3:30 to 6. We have pre-registration link and all the other information you need to know about this at local12.com. I really loved the way she said very politely, this isn't all about you, that it's our responsibility. Public health is everyone's responsibility. So if I get this, I could make someone else sick. I will say, I've heard people say to me, I've been coughing for months now. That 100-day cough. Yeah. So pay attention to that. It could be something more. And if it is, and it's bacterial, you need to see your doctor for treatment.
Wow.
All right, we are back at 5:30 with some great information today from Children's Hospital talking about